I find it fascinating that people will ask, well, how do you feel not dealing with patients anymore? But what they don't understand is
Everything you
informatics
do affects.
deal with all the patients. Like we
Right.
have to think about how everything reflects for a whole population.
Yeah.
And it's not just one patient or the 6 patient load. Now
Right.
it's when you look at OB, it's all of OB. What am
Mm-hmm.
I doing to this documentation to make it better for these nurses who care for
Mm-hmm.
OB or surgery or just
Yeah.
the whole healthcare population in general,
Absolutely.
even in ambulatory? One of my roles allowed me to be a coordinator for a health system. And being that coordinator, I had to learn all the different roles inside of a health system. So not just ER, but med surge, labor and delivery, OR. And then I also had to learn ambulatory. And there is a ton of regulation and documentation change that goes for ambulatory that is
Yeah.
not even in the world
Yeah.
of the healthcare acute side of the house.
Uh-huh.
So I will say that informatics opens your eyes to the whole system
Yeah.
and it gives you a broader perspective
Yeah.
of healthcare in general and how healthcare is so important and vital prior to the patient coming in, as
Mhm.
well as how do you make sure the patient gets what they need when they leave, right?
Absolutely.
How do you get that whole 360 view and make sure that 360 compass of that patient is getting everything they need? And I think
Absolutely.
nursing informaticists have a great opportunity at being at the table and helping lend their expertise in creating that 360 view.
So needed, like you said. Nursing voices sometimes are not as loud, and we're not often at the table when big changes are happening in the healthcare systems where we work. They just happen, and then we're told about them, right? But I think just putting your foot in the door and saying, you know what, I'm coming in and I want to do this for the nursing population because we need it. And then other people see that and start to say, you know what, that's true. We do need to make this change for our population because our workflows and bouncing from one screen to the next is only wasting more time that we're spending with the patients